I want to start by saying that I support this bill in its current form with amendment that will provide going forward. But, Madam Speaker, I wanted to ask the chair of the committee. This bill, I believe, Madam Speaker, should have started at clause 4 by providing... Madam Speaker, protect me because I can't hear myself. If you may, please.
Please lower the consultations. Lower the consultations, honorable members.
Thank you. Madam Speaker, I would have imagined that if you wanted a more serious surgery on this sector, the first clause after 3 would have been a declaration that no public servant will seek medical services from the private sector. Number 2, I would have wanted a provision that says that this parliament shall not approve any budget for any institution, judiciary, executive, or parliament that would take private insurance. Then you would tell Kenyans you're providing social help. But if you still leave us parliamentarians to have our own medical scheme, judiciary's own medical scheme, everyone else with their own medical scheme, then we are still throwing most of the Kenyans under the bus. I would imagine that if we want to do a thorough job, let's carry all Kenyans in this basket. Then you'll be showing seriousness in sorting out this issue, Madam Speaker. Number 2 is this bill in its current form, Madam Speaker. I agree with what they provide for. But unless there's also provision, concerted effort to ensure that facilities from the dispensary, health centers to level 3 and level 4 are provided with basic standardized equipment, personnel, then you'll be going towards getting what you're looking for called social health. But merely naming it, merely chunking the funds into one you are calling now, primary, another one you are now calling emergency, another one you are calling chronic. Madam Speaker, we'll need to make amendment to this bill to ensure that the bill deals with 3 very important issues. 1, quality of medical services, so that people can get services wherever they are. Where I come from in Uganda, people travel 40-50 kilometers to do X-ray. Dispensaries, 30 of them in my county, out of maybe 40, only 3-4 have laboratories, a microscope. Potassium malaria is not there. So you can talk about money, talk about how you're going to fund it, but if our institutions are not to a level where they can provide quality services, it's kaput. Won't go anywhere. Madam Speaker, the cost of provision of medical services in this country is terrible. Today you'll go to Kenyatta Hospital, do an X-ray. You go to another doctor tomorrow with the same X-ray, you're told, Apana, you have to do another X-ray on the same issue. Today you are told to go and do an MRI at another hospital. If you go to Kenyatta University Hospital, you are told do another X-ray or another MRI of the same issue. We will not sort out the corruption in this sector if we don't get our hands into those kind of malpractices, Madam Speaker. Madam Speaker, it's now almost a cliche that every public hospital has a pharmacy along the road run by either the head of that public service or a doctor in that public service hospital or something around there. And that's why every time most public hospitals have no medicines, have no drugs. Madam Speaker, I agree with what's being proposed here. But unless we go to the crux of the matter, adequacy, we have dispensaries and clinical health centers that saw their last doctor 4 months ago. The doctor comes once in a week. The hospital is run by a nurse. I don't see them being handled here. Madam Speaker, the governance of NHIF, the management of NHIF, if we don't deal with it again the right way, it will be just same monkeys, different forests. I hope our government, the Kenya government, will not end up with the same thing you've seen before, where you reorganize a system to bring your people in. Let's not do that. Let's make honest, genuine, effective changes to our social health system so that we as a people can be proud of what we are doing. And that's why I agree with Honorable Junet and all those who have said that if you are creating an authority to manage our funds, why do you want to outsource it? Why do you say in law specifically that you will give some medical service providers work You are not getting work for private sector. And that's why I thought that if we are borrowing from NHS of the UK, Madam Speaker, by the way, NHS is managed completely and entirely by government. There is no intermediaries. Madam Speaker, I thought I would see provisions. We just, passed the second reading of the digital health bill. 40% today of the monies we pay for health provision go into records management, managing our health records, sharing health records, Madam Speaker. And I thought that with the kind of changes we are making, the cost of provision of services could go down to ensure that we are doing the right thing. Madam Speaker, I was very happy yesterday when I saw the President launching the health promotions framework. Madam Speaker, this is the way to go. That most ailments, most of our monies don't go into treating things ailments that would have been prevented much earlier. And so, and to request members of Parliament here today, the Ministry of Health, the county governments in the country, invest more in prevention, invest more in promotion. It is the way to go. Let's not, Madam Speaker, people die in our villages, very simple ailments, things that could be dealt with through just civic education on, say, lifestyle, on, say, how to deal with small things. Nowadays, basic things. People have to go from Madam Speaker. I've been looking at the issue of transitioning NHIF. Madam Speaker, we cannot declare the workers there guilty. No one has charged them. No one has put them under any microscope and said you are not fit enough. Madam Speaker, but you can't put their fate before a board, which is coming new tomorrow, that has instructions that you're going in there to clean it. Clean what? No one has been judged to be corrupt or bankrupt or malfeasance. So we must give them a fair hearing. Even before we ask them to go, must give them a fair hearing. Madam Speaker, in this current system, I believe that we must also start reducing the wage bill by reducing the size of the boards we set up. This board, if you look at it, has 11 members. 11. Why do you need 11? You just need 4. If you need quorum 5. Why do you need to desegregate and start apportioning? You apportion and say, Kotu will be in the board, KMA will be in the board. Why do you have those ones in the board? Then I'll also want Parliament to be in that board. I want LSK to be in that board. Why don't we have lean boards in the bodies we're going to be getting going forward that can do their work? When you have bigger boards, politics gets in, your remanding gets in, Madam Speaker, and you're not able to move. I would wish to request the majority leader, if you can have only 5 members of the board, because if you already have the PS Health in the board, why do you need the DG? Why do you need the AG in this board? AG is always providing legal services to all government institutions. Why do you need the AG? Why DG when you already have PS Health? So if we could make provisions to reduce the size of the board, Madam Speaker, I'll be very happy. Madam Speaker, finally, Madam Speaker, I want to request, should this bill go through, the minister concerned, because we have given the minister so many powers. Almost at the end of every clause, we are talking about the CS will do this. At the end of every clause, the CS cannot tell us what benefits we will get in an insurance scheme that we are paying for. This Parliament should set up those benefits that we're going to get. Kenyans should know early enough that if you are paying, this is what you get. We cannot leave regulations that have very far-reaching implications to the CS. And so, going forward, we're going to make proposals, Madam Speaker, that should make this bill all-encompassing with serious surgical provisions that would make health care as good as it could be. Madam Speaker, I thank you.
Thank you. The Deputy Majority Whip.